Good afternoon. Thank you for coming in. Are you here to see Dr. Collab? Okay, that's great. Please feel free to get comfortable. With your permission, would it be okay for me to just verify some of your details personally? Okay. Your first and last name? Mm-hmm. And your appointment is... You're a little bit early, that's great. Okay. Your date of birth? And it looks like you just recently had an exam for some cardiovascular testing. How do you feel about that? Okay. Anything insightful? Okay, that's good. And since that exam, have you noticed any changes in just how you're monitoring yourself and paying attention to certain characteristics of this? Okay. How have you felt for the last bit of time? Alrighty. So some of the previous notes that I have on here relating to your symptoms, have those remained the same? Have they gotten any better? Are there any other instances where you feel these were more noticeable than before? Okay. I'm sorry. Alrighty. And on a scale from 1 to 10, 1 being very relaxed, nothing bothering you, completely calm, 10 being anxious and unable to process, where would you put yourself as? And from the previous exam, how does that vary from that experience? Mm-hmm. Okay. And there's a note on here for sleeping patterns. How have you been sleeping? Yeah, I'm sorry. Okay. On average, how long would you guess your sleep is in block increments, between interruptions? How about for the last couple of days? Okay. Alrighty. Well, that pretty much sums up some of the details. I can hand off to Dr. Calliope, and she'll take extremely, extremely good care of you. Yeah, she's about as chill as you can get. Alright. If that's any words of comfort that I can offer, you're in good hands. Please help yourself to any kind of beverage, anything that would help you to relax, focus. Just be a moment, okay? Thank you very much.
Hello there, and welcome to my office. My name is Dr. Calliope. How are you doing today? Okay, yeah, a little nervous. I can understand that. I hope that by the time you leave this office, you feel even just the littlest bit better. Okay? We're going to do everything we can to ascertain what's going on, and hopefully we can get you to a more healthy lifestyle, okay? Alright, so Let's see. Do you mind just confirming your name and date of birth? Excellent. Very good. And is that your preferred name, and how do you like to be addressed? Okay. Very good. Thank you. So, let me just take a moment. You saw Dr. Yvette from cardiology, right? Okay. So it looks like from all the tests that she did, there didn't seem to be anything conclusive, right? Okay. So just because she didn't find anything doesn't mean there's not anything wrong, right? When our tests don't yield any results when we first try them, that's our clue that begins a conversation rather than ending it. That tells us we have to look a little harder, right? Okay. All right. So what I can do for you today is I work with neurology. I'm a neurologist. So I'm going to test your cranial nerves. I'm going to test your motory and sensory functions. We're going to test your coordination, your autonomic nervous system, and a little bit of blood flow as well. Now, this sounds like quite a bit, but it's very easy to test these sort of things, and all you have to do is follow my instructions to the best of your ability, okay? All right, so this will help us rule out quite a bit of things, and we'll see if we can pin something better down for you by the end of this visit, okay? All right, so first we're going to start with the cranial nerve test. Now, your cranial nerves are, of course, a bunch of nerves in your cranium, right, your skull, and these nerves govern things like your sense of smell or your swallowing. Some of them have functions with your heart rate, your ability to shrug your shoulders. There's quite a few different functions of all of these nerves, and I'll be testing them to make sure that they're intact and that nothing is going on with them. If one of your cranial nerves isn't functioning right, then we can discuss treatment afterwards, but some of them, it can be quite easy. For example, if your trigeminal nerve is a little pinched, which we see with people that have a lot of muscle tension around their neck and their occipital area, if they get that impingement, you might feel tingling or numbness on the side of your face, but with a little bit of physical therapy and relieving that tension, we can see those symptoms go away. So it might be very easy, okay? So I don't want you to be worried if we find anything, okay? All right, so we're going to start with your olfactory nerve. That's your first cranial nerve, and it governs your sense of smell. Now, from this point onwards, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Excellent. Thank you so much. So I'm going to have you close your eyes for me, okay? And I'm going to have you smell something, okay? So I'm just going to hold this under your nose, and I want you to tell me what you think it smells like, okay? Just going to just wave this under your nose. And what does that smell like to you? Okay, kind of mentholy? Yeah, so that is a eucalyptus mint kind of smell. So menthol would be correct. So your sense of smell looks to be intact. You haven't had any problems with it in the past, have you? No. Okay, very good. So we're going to test your cranial nerve number 2, which is your optic nerve. Your optic nerve governs your sense of vision. So have you had any problems with your vision as of late? Okay, no. And I'll double check in your chart, but have you had an eye examination recently? Okay, quite recently. That's good. And they didn't find anything wrong there. Okay, so then for our optic nerve, we're just going to test your peripheral fields, okay? So I am going to have you put your hand over one eye for me, okay? Yep, and I will mirror that same eye, so we both have this eye covered. I'm going to bring my fingers in, and I want you to just tell me when you see them come into view, okay? I'm going to test the 4 quadrants of your vision. Okay, so you just let me know when you see my fingers come into view. Okay? Good. 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 Okay, we're going to switch sides real quick. So go ahead and cover this side. And I'll cover this side. Good. 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 Excellent. Okay, so your peripheral fields look pretty great with that test. We're going to do another test, and I'm just going to have you look straight at my nose, okay? I want you to keep your eyes focused on my nose, and I'm just going to be wiggling my fingers at one side or the other. I want you to just tell me which side you see wiggling, left or right, okay? Yeah, real simple. So just look at my nose, and I want you to tell me when you see the fingers wiggle, okay? Good. 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 Excellent. Okay, so that looks great. I'm just going to take a note real quick. Okay, so for our next tests, we're going to be testing cranial nerves number 3, 4, and 6. These are your oculomotor, your trochlear, and your abducens nerves. These govern your eye movement mostly, okay? So real quick, I just want to have a good look at your eyes. I'm going to get a little close for this, okay? So I just want to make sure that there isn't any sign of drooping in the eyes, which might indicate a problem with our cranial nerves 3, 4, and 6. And your eyes look good up close. While I've been watching you from afar, I haven't seen any signs of any ptosis, so that's good. Now, to test your eye movement, we do a test called Follow the Light. Now for this, I'm going to use a pen light here, and I'm just going to have you track the movement of the pen light using only your eyes without moving your head, okay? So I'm just going to have you focus right here. Make sure to use only your eyes without moving your head, okay? I want you to follow this light. Good, just like that. Just follow the light to the best of your ability. That's wonderful. Just keep tracking the light. I know sometimes it goes a little in and out, but just do the best you can. Good. Okay, let's go up, down, side, the side. Good. Up, down, the side, side. Okay. How about diagonally up, diagonally down, diagonally down, diagonally up. Good. Diagonally up, diagonally down, diagonally down, diagonally up. Very good. Okay, so your eye movement looks great. I didn't see any delay in any of your movement. There wasn't any skipping. Okay. Okay, so next we test cranial nerve number 5, and this is your trigeminal nerve. So we're going to be doing a couple tests like this, but we're going to start with your face. We're going to do something known as the soft, sharp sensation test. I have a cotton bud and I have a toothpick. And I'm just going to be pressing these along your face, and I just want you to tell me whether you feel the soft or sharp sensation, okay? I'm just going to test these real quick along your jaw so that you can see what they feel like, okay? Start with the soft. Okay? And then we're going to do the sharp, which is just a little poke, not even a prick necessarily. It's definitely not enough to hurt, okay? Just gives you a sharp point of sensation. Just going to poke, 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 poke. Okay, you feel that? Excellent. So I'm gonna have you close your eyes for me. Okay? And I just want you to tell me whether you feel the soft or sharp sensation. Okay? Good. Close your eyes. Keep them closed. Okay? Soft. Sharp. Soft. Soft, sharp, soft, sharp, sharp, soft, 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 sharp. Very good. We'll put those away for now. And now I'm just going to feel along your masseter and your temporalis muscles in your face, okay? So when I ask you to, I'm going to have you clench your jaw for me, okay? Just want to check around, feel for any wasting or any problems with the muscle tone, okay? So I'm just going to have you clench your jaw for me. Good. Release. Clench. Release. Clench. Release. Good. I'm going to feel around your temporalis. Okay. Clench. Good. And release. Clench. Release. Clench your jaw. And release. Very good. Okay. That felt good. You can take just a moment. Okay. So I'm going to have you follow my instructions for just a moment, okay? We're going to test your facial nerve, which governs a lot of your facial movement, okay? So first, I'd like you to open your mouth real wide for me, okay? Good, and close your mouth. And if you could smile real big for me. Yep, show your teeth. Good, and if you could frown for me. Good, and puff out your cheeks. Excellent. And if you could close your eyes real tight for me. Very good. Go ahead and keep them closed for just a moment. I'm going to try to open them. I want you to resist me. Keep them closed, keep them closed, keep them closed. Good. Okay, you can go ahead and open them. All right, that looks great. Okay, so for your acoustic nerve, there is a couple of things we can do, but one of them we are going to be testing a little later on, so we're just going to focus on one test for now. So to test your acoustic nerve, we're going to stick with a little hearing test, okay? So I'm going to be using a tuning fork for this test. This is a C note. It is a 512 hertz tuning fork, okay? So I'm going to be striking the tuning fork, and I'm just going to have you tell me whether you hear it in your left ear or your right ear, okay? All right, so I'm going to have you close your eyes for me. That way you can't see what side I'm on, right? Good. Mm-hmm. Good. Good. Mm-hmm. Okay, very good. So your hearing is intact. You haven't had any problems with that lately, have you? No. Okay. Have you had a hearing test lately? Oh, I see. So you've had one very recently as well. Excellent. Okay. And they noted down that there isn't any hearing loss. Very good. Okay, so then for your balance test, we'll do that a little later on, and that further tests your acoustic nerve. So now we're going to look at the glossopharyngeal nerve. So we're going to do a little swallow test. This also tests one of your other cranial nerves as well, but I have a little bit of water here, okay, straight from the tap, and I want you to take a sip of this water, hold it in your mouth, and when I tell you to, go ahead and swallow, okay? So here's this for you. You can take that when you're ready. Good. Take a sip. Hold it in your mouth. And swallow. Okay, good. Was there any issue with that? Any problem in doing that? No? Okay. Very good. Let me just note that down real quick. So that also helps test your vagus nerve, which is cranial nerve number 10. And now we're going to be taking a look at your uvula in the back of your throat, okay? So I want you to just open your mouth for me, okay? Very good. And let me see. We're just going to hold your tongue down here, okay? Very good. And if you could say ah for me. Very good. Okay, you can go ahead and close your mouth. All right, so glossopharyngeal nerve looks great. Now, for the last two nerves, we just have a couple of simple tests, okay? So for your accessory nerve, all I'm going to have you do is shrug your shoulders, okay? Pretty easy, a little hard to fail. So if you could just shrug your shoulders for me. Good. Now, I want you to bring your shoulders up, and I'm going to try to push them down, and I want you to resist me, okay? Okay, resist me pushing down. Good. And now I'm going to push down on your shoulders at rest, and I want you to press them up against my resistance, okay? All right, go ahead and lift your shoulders up. Okay, good. You have good strength in that. Now finally, for our last cranial nerve, number 12, we have the hypoglossal, and this governs your tongue movement. So we're going to have you stick out your tongue, okay? Yep. And we're going to do a little movement test. So if you could move your tongue up, and down. Good. Side. And the other side. Okay. Can you open your mouth for me and lift your tongue to the roof of your mouth? Very good. Just going to take a little peek while I'm here. Okay, great. So you can go ahead and let your tongue rest back down. All right. Good. So that concludes our cranial nerve exam part of our assessment today. Now, I'm going to be looking at signs that your motor nerves are having some issues. So for this, I first want to check for any muscle wasting. I want to just feel around the muscle tone in your extremities, okay? And then we're going to be doing some resistance tests to test the strength of your muscles. Okay? Good. So I'm going to feel around your arms, your hands, your legs, your feet. Okay? All right. Don't need to do anything. Just relax here. It's rather warm in the office today, isn't it? I know. Heat waves, huh? It came a little late for us, though. As much as I do detest being uncomfortable, I much rather detest being cold when it's supposed to be hot. So, I don't mind. I mean, the AC constantly runs, but that's okay. Okay, so while I'm here with your upper extremities, we're just going to do those resistance tests, okay? So first, I'm going to have you put your arms up like this, okay? So your arm is at a 90-degree angle. You're holding them up against me, okay? And I'm going to try to push your arms forward. I want you to resist me, okay? Good. And now I'm going to try to pull you towards me. I want you to resist me. Very good. Okay. So you can go ahead and relax your arms real quick. So I'm going to have you splay your fingers for me like this. I'm going to try to push them together. And I want you to resist me. Very good. And if you could hold your fingers together, I'm going to try to pull them apart, okay? And I want you to resist me. Good. Good. Okay. So now I'm going to have you hold your hands up. I'm going to try to push your thumb down. I want you to resist me, okay? Good. Good. And now I'm going to try to pull your thumb up, and I want you to resist me. Good. Excellent. Okay. So now I'm going to move on to your lower extremities. So I'm just going to feel around your legs. And a little bit into your feet as well. Okay. Tone looks good. So now for our strength tests, I'm going to put my hands on top of your knees and I'm going to push down. And I want you to try to push your legs upwards, okay? So I'm going to try to push down. I want you to push up. Good, okay. Now I'm going to hook my hands underneath your legs here, and I'm going to try to pull up on your legs. I want you to push back down and resist me. Okay? All right, I'm going to try to pull up. I want you to push down. Good. And now with your shins, I'm going to try to push them forward, okay? I want you to resist me. Good. And now I'm going to try to pull them towards me, and I want you to resist me. Good. And now with your feet, I'm going to have you just have them out. I'm going to try to push down. I want you to resist me. Good. And now I'm going to try to bring them up from the bottom. I want you to resist me. Good. And now I'm going to try to pull your big toe upwards. I want you to resist me. This one can be a little tricky. Good. And if you could just point your toe up, I'm going to try to push it back down, and I want you to resist me. Okay, very good. So that looks good. Okay, so now we test your sensory nerves. So we're going to start with that soft, sharp sensation test that we did earlier on your face. And I'm going to have the toothpick and the cotton bud. And I'm just going to be touching along the arm. And you can tell me soft or sharp, okay? I want you to close your eyes for me. That way you can't cheat. All right. And I'm just going to either do the soft or sharp sensation on your arms. Okay? Soft. Sharp. Soft. Soft. Sharp. Soft. Good. Switch to the other arm. Soft. Soft. Sharp. 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 Soft. Very good. Okay. I'm going to do that on your legs and feet. Okay. I'll start with one leg and then move to the other. Soft. Soft. Sharp. Soft. Sharp. Soft. Okay, and the other. Soft. Sharp. Sharp. Soft. Soft. Sharp. Good. Now the next one, we're going to test your vibration sense. So I'm just going to be striking a tuning fork, and in addition to making sound, of course, sound is just vibrations. You may not be able to hear this one well, but this gives great vibration. So I'm just going to be placing it on your skin, and I want you to just tell me if you feel the vibration, okay? All right, so I'm just gonna have you close your eyes again for me. You just let me know when you feel any vibration. Good. 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 Yep. Very good. And now I'm going to test on your legs. Good. 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 Very good. I know that's a little bit of a strange sensation. Okay, so now we're going to test your position sense. So I'm just going to move your finger either up or down, and I just want you to tell me whether it feels like it's up or down, Okay? That's all you have to do. So if you could just put your hands out in front of me. Good. We'll start with one side. So this is up and this is down. All right? So if you could just close your eyes for me. Okay? And I'll just move this up, up, down, up, down, down. Good. The other side. Down, up, up, down, down, up. Very good. I'm going to do that with your toes real quick. Okay? So this is up and this is down. Okay? Good. So you just let me know what position your toes are in. Up, 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 down, up, down, down. Good. Up, down, up, down, down, up. Very good. So position sense looks great. Let's go ahead and test your reflexes real quick. Okay. So I'm going to start from the bottom of your body and work up. Okay. So we're going to start with your Achilles tendon. I just want you to let your legs hang freely for me. Okay? I'm just going to come around to the back of your foot and just tap, tap. Good. And tap, tap. Excellent. So we're going to do the knee jerk. Tap, tap. Very good. Tap. That was a little better. There we go. Okay. And now we're going to test the biceps reflex. I'm going to put my thumb right in the crook of your elbow, and I'm just going to be tapping on my thumb. Okay. Just let your arm relax for me. Good. Good. The other side. Okay. Good. Good. And your triceps. So I'm just going to lift your arm up. I want you to let me take the weight of it. Okay. Okay. Good. The other arm. Let it relax. There you go. Reflexes look great. Okay, we've got a few more tests to do. All right, I promise it's almost over. So we're gonna do a little coordination test. I'm gonna be holding my finger out in front of you. I want you to touch your nose and then my finger. Okay, just like this. And I might move the finger around. I want you to continue to try to touch my finger, okay? So I'm just going to put my finger up. I want you to touch your nose and then my finger, okay? Back and forth as fast as you can, right? Touch your nose, touch my finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, good. Okay. So you just note that down real quick. Okay. And now I'm going to have you, with eyes open, touch your own nose, okay? And then put your hand back down. Good. And now close your eyes, touch your nose, put your hand back down. Very good. Okay. So now we're going to do a little bit of balance testing as well. I want you to stand up for me, okay? And if you could have your arms straight out, all right? I want you to close your eyes and walk forward for me, okay? I'll make sure you won't fall. Just close your eyes, arms outstretched, and walk forward a few steps. Okay? Okay, good. You can go ahead and stop and open your eyes. All right? So last test, we're going to test your blood flow a little bit. I want you to just go ahead and sit down for me. First, I want to take a little listen for any bruits in your carotid. So a bruit is an audible heart murmur. And I'm just going to auscultate one side at a time, okay? So I want you to take a deep breath in for me and hold it. Good, and exhale. Good, and one more time. Take a deep breath in for me. And hold. Good, and exhale. So let's talk a little bit about our findings, all right? So to be honest, on the neurological side, I didn't find any problems, which is both a good thing and a bad thing, right? Because at least if we found something, then we had something to point to, somewhere to investigate further. But it's also a good thing because obviously you don't have any problems neurologically, but also I think I have a better idea about what's going on, okay? So what I think is going on based on your symptom list and everything that I've observed with you, I think you are having what's known as panic attacks. You've probably heard of them. They're quite common, actually, and many people with generalized anxiety, PTSD, OCD have them. And even people that don't have an anxiety disorder can get panic attacks as well. Now, the problem with panic attacks is that they mimic so many problems, right? And it's basically your body's warning system is going off, right? You have your fight, flight, freeze kind of system, and your body is just pushing all red lights. Now, what's even more tricky with panic attacks is oftentimes you don't understand why it's happening, especially if you are, say, driving or you're out with friends or you're just minding your own business and all of a sudden you start getting all these awful symptoms that don't make any sense, right? So then we also can call them silent panic attacks, right? There's a lot of things that are going on. We don't understand why, but they're still happening nonetheless, right? Now, the way we can identify these is by looking at our symptoms. I'm going to read you a list of symptoms we see in panic attacks, and it wouldn't surprise me if quite a few hit home for you. So you can get palpitations, pounding heart, or an accelerated heart rate, sweating, shaking, the sensation of shortness of breath or a smothering feeling. We have a choking sensation, chest pain or discomfort, nausea or abdominal stress, feeling dizzy, unsteady, lightheaded or faint, chills or even heat sensations, numbness or tingling sensation, derealization or depersonalization, which is basically like you don't feel real, you don't feel like a person, almost like disassociating, fear of losing control or going crazy, and fear of dying are the main symptoms to watch out for. Now, any of these symptoms on their own are scary, and they would lead you to believe that something's going on. And I think you are right in coming to me and Dr. Yvette to try to figure out what's going on. But I think that we're dealing with panic attacks. And on the one hand, while that sucks, it sucks a lot. On the other hand, they don't have any long-term health consequences, especially if we can get them tamped down a bit. And there's a multitude of ways to treat them. We can do lifestyle changes, we can go the medication route, we can try therapy. There's quite a few different avenues that we can take, okay? So the good thing about panic attacks is that they don't generally last very long. So typically they last between 5 to 20 minutes. And generally at 10 minutes is the peak time. That's the time where you feel the worst. Now, almost all of them subside within an hour. You can get recurrent panic attacks when you start recovering from one and just go straight into another. That is possible. But again, if it's a one isolated incident, at most it'll take up to an hour. Okay? So a few different ways that we can treat this right now is we can do progressive muscle relaxation. So there's tons of videos and resources out there. But when we have panic attacks, we oftentimes will tense up our entire body. This will make all those sensations feel even worse, okay? You'll feel really sore after. You'll probably feel pretty exhausted, yeah? So to do some progressive muscle relaxation when we're in the throes of a panic attack, it'll help keep us a little looser. It may help the panic attack itself, but it'll definitely help that muscle tension, okay? Another thing we can do is taking time alone, either by ourselves, or you could also have someone you trust, someone who can help guide you through a panic attack for a little bit, in a quiet area, an empty room, even against a wall. You want to reduce the stimulus, okay? Because more noises, more sights, things like that can throw you even deeper and make it go even longer, okay? We can also do breathing exercises, including, we've seen in movies where people breathe through the paper bag kind of deal. Well, there's a reason they do that, and the paper bag deal is because you're breathing in that recycled air, and that extra carbon dioxide that you're breathing in will increase in the blood, and it'll calm you down a little bit more. Otherwise, you can do some deep breathing. Now, sometimes this makes panic attacks feel worse. So if you start feeling worse after trying to do a little bit, go ahead and stop, okay? You don't want to make yourself feel worse. But a lot of times when we're hyperventilating, we feel short of breath, then breathing in deeply reminds us that we still have the ability to breathe. It helps guide us through, okay? We can also do some distancing and distracting. These are two skills used oftentimes in DBT therapy, and we use this when someone with emotional intensity is experiencing a 4 or a 5 out of 5. And what you're doing is you're removing yourself from the situation. Either go to a different room leave your house, go back to your house, just change your environment and do something distracting. Whether that's playing a video game, tidying up if you want, drawing, something you like to do, okay? And we do that until that intensity comes down, all right? And lastly, we could talk about doing therapy as well, which is helpful for many people. And you don't have to do that right now, but that might be able to help find the cause of your panic triggers, and it can give you a lot more tools in your toolbox to try to address them. Now, with panic attacks, you may find one method is more successful than another. And then the next time you have one, you may notice that that method doesn't work anymore, but another one does. What we want is a multitude of options so that if something doesn't work, you switch to something else. And then hopefully one of those will help you out. And even if you've gone through all the tools in your toolbox and nothing's worked, more than likely by that time, the panic attack will be subsiding anyway. Okay? So even doing something like walking, going on a walk, that exercise can help calm your body down, that helps distract you, that helps distance you from either the area that's triggering you or just getting you away in general, getting you to a new environment. All right? So this is a lot of information, so I'll be sending this home with you, okay? I don't want you to feel like it's stupid or like it's just simple and you should be able to get through it, because it is scary. And your body's just trying to keep you safe. And it doesn't really know exactly how. It's an evolutionary thing that didn't quite catch up to the times, right? So your body thinks that you're in danger, and in the past, that's what you did, is you panicked. You ran from whatever was dangerous. Nowadays, there's not a whole lot that's immediately dangerous. So your body's just trying to protect you. Unfortunately, it just doesn't know how. Not in a constructive way, at least. Okay? So that's how we learn these different things to basically be like, okay, I understand, you're just trying to protect me, but this isn't very productive for me. So it takes a little bit of time and a little bit of work, but it is possible to reduce the frequency, and you can see remission as well. Okay? So I'll send this all home with you. And if you have any more problems with this, go ahead and let us know. Okay? We may need to do something like medication to help get them under control, get you back to an even keel. And then when you feel a little bit better on your own, you might be able to retry some of these different things and revisit them. Okay? This doesn't have to be forever. Okay? All right. Any other questions for me at all? Okay. If you do have any questions, just let me know. If you want me to try to put in any referrals for any therapist or even a psychiatrist, if you want to try medication, we can definitely do that. Okay? All right. So thank you so much for coming into my office. I hope you feel a little bit better and have a bit of a better answer. Okay? So I hope you have a whale of a day and a good rest of your night. Thank you. Bye now. Thank you so much for watching. I really appreciate it. Please like this video if you want to. Comment if you'd like to. And subscribe